to be done within 24 hours.
This guidance comes as the U.S. battles high rates of seasonal flu. So far, there are 67 reported cases of bird flu in humans and 1 death associated with the virus.
Joining us now for more is NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, good morning. Always great to have you with us. So this guidance by the CDC to do this type of testing, it's actually been in place since last fall, but now they're pushing for this to be done more quickly. How's this going to impact the care people get, and why does it need to be done more quickly?
Well, good morning, Savannah. Good morning, Joe. This is going to impact care because, first of all, early detection of flu, this respiratory virus we always talk about, is vital because we have treatments, but those treatments work better the sooner you get them into the body. And so that's why it's important to understand what type of flu you have. Influenza A and influenza B, 2 types of flu that can impact humans. Influenza A is the issue here. And you can detect that with a rapid test in an urgent care clinic or in a hospital. But to really understand whether you have bird flu, which again, there's a minority of cases, you have to have centralized hospital PCR testing. And the sooner we get that, the sooner we can understand, well, gosh, does that patient have close contacts at home? Do they need to get tested? So if there's a potential outbreak, we can snuff it out.
PCR testing, a term we all got to know during the COVID pandemic. So this alert comes from the CDC as flu cases are surging across the country. So this new testing guidance, it only applies to patients with influenza A viruses. Talk about why that is. Is it because of similarities to the bird flu?
Yeah, that's exactly it, Joe. Bird flu is a type of influenza A virus. So most adults across the country, across the world, if they're going to get sick with the flu, it's going to be influenza A. Influenza B, we don't talk about it as much, generally impacts children when it's present. Vast majority of these 110,000 hospitalizations, though, that we've seen, all influenza A. But to your point, that PCR testing, that special test that we talked about all the time during COVID, that's what's required to understand, well, God, what's the subtype here? Is it typical human flu or is it bird flu in this case? And again, important to distinguish because Tamiflu we know works against both bird flu and human flu, but it works not as well against bird flu. So that's why it's really important to understand.
Doctor, we've been talking more and more about bird flu. People are probably starting to see more headlines in their paper, that kind of thing. I've heard from people who I think the vibe is kind of like, we've seen this movie and we did not like the ending. I mean, how worried should the general population be at this point? Is this something that we are kind of on the beginning of what could be a critical mass?
I do think state governments, Savannah, need to take this seriously. The federal government needs to take this seriously in terms of preparedness. So what does that mean for the general public? General public, the risk is low, but it's a mixed message because here we're talking about it. We're saying the risk is low to the general public. It is something that government officials and policymakers need to take seriously in terms of testing poultry, cattle, areas where we know it's spreading, to understand the risk to humans. Right now, that risk is low. It could change. What they're doing in California, Governor Newsom issuing a state of emergency to ensure there's more testing of these at-risk animal populations. That's what we need to see, frankly, more of to understand the risk. And also, that's exactly underpinning the CDC guidance. This is not new. You said this in the tee-up. There's just more urgency now to really understand, are we actually undercounting how much bird flu there is? That's the important question.
Dr. Vin Gupta, thank you very much.
Coming up, more drama for